So, I'm just going to give a very, very brief comments about a task force that I'm engaged in. And first of all, thanks for inviting us to come and present this. I think originally Steve Morrison, who is at CSIS and running the task force, was going to present. But I was upstairs anyway, and so they said, come on down and do this. I'm actually on another National Academy panel that just let out a few minutes ago. So nice to be here and nice to see so many old faces, old friends. Nice to see so many old friends and new faces and old people. But anyway, CSIS, for those who don't know, is the Center for Strategic and International Studies, and there's Steve Morrison heads their Global Health Center within CSIS. I am a trustee of CSIS, but also am serving as the co-chair of a CSIS task force that was recently launched on women and family health. And as everyone knows, in Washington, in the think tank world, when there is about to be a change in administration, everybody runs with their new ideas, launches task forces, and thinks up great ideas that hopefully will stick and be able to make a difference. And so this is a task force that's in that context. It really is looking at trying to think about how a lot of the gains that the United States has contributed to in global health don't get lost in the transition. And I think that's what a lot of us are really focusing on. How do we make sure that the incredible gains, and you all talked about them earlier, don't get lost? And are there ways that we can continue to move forward on some of the very, very key areas focused on global health? So this task force was launched in October of last year. And as many of the CSIS task force are, they're comprised of members of Congress as well as people from diverse backgrounds. We have 25, as it says here in my talking points, 25 diverse, prominent opinion leaders, of which I am one. And it also includes 6 members of Congress. And we're really pleased because it's bipartisan and also bicameral in terms of the representation. So we have 3 Republicans, 3 Democrats, 3 members of Senate, as well as 3 members of House, advocacy groups, universities, industry, foundations, et cetera. So it really does have a diverse background. I co-chair this with John Hammergan, who is the president of and CEO of McKinsey Pharmaceuticals. So intentionally looking at having somebody who represents industry as well, because I think one of the key areas that we're focused on is really making sure that the private sector has a real role in our global health engagement. And we started out concentrating this work on women and family health in 4 sectors: family planning and reproductive health, immunizations, maternal and child survival, and nutrition. For obvious reasons, those are 4 key areas, 4 areas where the U.S. has had made a great contribution, and areas where the role of women and family health is key. We also wanted to emphasize a few cross-cutting issues, looking at better integration, which, as we all know, we tend to think of these things in stovepipes, but the need to really look at a much more integrated way at these issues. 2, looking at how to incentivize the private sector to be more engaged and have more partnerships, and looking at the role of investment and trade. And then 3, looking at how to better focus on research and take advantage of thinking about new innovations in these areas. And then looking at a couple of particular populations that are timely. One, looking at the area of Zika and how it figures into this, and then the burgeoning refugee population, again, for obvious reasons right now. The goal is to have a final report in March of 2017, and a lot has been done in the meantime, to kind of start putting together the database and background for this, it includes work that's been done by the Kaiser Family Foundation looking at budget analyses around what we've already spent. Chris Murray and his group at Institute for Health Metrics and Evaluation has also looked at the area of investments and then future forecast in terms of resources. We have sent delegations in Zambia, Ghana, and Senegal to look at the work on the ground and what's already being done. What are some of the where have some of the investments worked best? Where are there some gaps so that the report is actually informed by real-world experiences? So and we've met 3 times as a task force. So there's been a lot of work going on already to develop a database to do this. And then we stepped back and thought about what's the right framing for this work, because again, thinking about how do we do better some of the things that we're doing, and just following on your comments, you're right. We don't always need initiatives to do these things. We do these things well, but we also thought that sometimes pulling things together in more of an initiative way does galvanize support differently than doing things separately. So we've now come together around a framing around adolescent girls and young women as really the focus of this report. And I know in this audience we don't have to give all the reasons why adolescents and young girls, but obviously with the youth bulge and what's occurring, a greater portion of countries that we're focusing on will have higher proportions of young adult and adolescent women. The fact that young women and as they move into adolescence often get lost between the cracks, fall between the cracks. The fact that our health systems don't necessarily have a place for adolescent girls who are not pregnant, because if you're not of childhood age and in the process of getting your immunizations or seeking maternal care, oftentimes that's an age group that gets that falls between the crack. And then the needs, the reproductive needs, whether it's sexual education, access to family planning, and reproductive health services, again, for this group, oftentimes don't get the attention and are not always suited to the needs of adolescent girls. Sexual transmitted diseases, we know the disproportionate impact of HIV and STDs on adolescent girls, gender-based violence, et cetera. So a whole host of reasons why focusing on this particular population may be a way of really galvanizing some of the support for the 4 areas that I mentioned, but doing it in a way that really puts a particular focus and support in this area. A lot of things to draw upon, and again, as you were talking about the different programs that are ongoing, with this initiative, we hope that we'll be able to get greater support, but it also builds on a lot of the things that are already ongoing. For instance, through PEPFAR and the DREAMS work, et cetera, the every child, every woman, every child, saving mothers, giving life, red ribbon, pink ribbon, the incredible work that USAID has been doing in this area, ending preventable childhood. I actually helped. Yeah, which rolls off one's tongue. But anyway, so all that to say, I think building on some of these efforts, we don't have to start from scratch, but having this unifying focus on adolescent girls and young women, we hope will help to galvanize some of the support around this. I think I will just end there. The real reason we wanted to be able to present to this group is that as you start fleshing out your thoughts about where you focus, we hope that there'll be some ways of either working in tandem and perhaps doing some things that are complementary, or intentionally doing things that are different, so that we're clear about how each other's reports will hopefully complement and also support each other. We hope that, as you continue on in your work, we'll have opportunity to present again, but we want to be able to share information and make sure that we're both informed by the work of these different groups. So, thanks.